Hello everyone, this is Dr. Nanya. Welcome to my channel. In today's video, I'll be talking about bleeding time test or clotting time test. Before beginning the video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is bleeding time test. It is a test that determines how quickly your blood stops or clots. This is a basic assessment of how your platelets are working. Talking about platelets, do you know what are they? Platelets are tiny cell fragments that circulate in the blood. They are the first cells to react to a blood vessel injury. They seal off the wound to prevent further bleeding and hence protect the body. Now let us see why you may require this test. Most of the people do not require this test at all. You may require this test if you have symptoms of bleeding or clotting disorders. Some symptoms may include having a past experience of a non-stop bleeding from a cut or a puncture in the skin. There are many types of different tests to evaluate your platelet function. A bleeding test is a screening test done for patients who have prolonged bleeding time. Now let us see how is this test performed. For this test, the site of puncture is usually cleaned so as to avoid any infection. Then, a cuff is placed around the upper arm and then it is inflated. After this, two small cuts would be made on the skin. These small cuts would be deep enough to cause slight bleeding. You might feel a slight scratch during the cut, but don't worry, these cuts are very shallow. After the cuts, the cuffs are removed. After every 30 seconds until the bleeding stops, the cut is blotted. This is how they record the time which was taken for the blood to clot. After all this, a band-aid would be applied on the cuts. So, how can you prepare for this test? No special preparations are needed for this test, but make sure you tell your doctor about all the medications that you are taking, including the OTCs, that is over-the-counter pills. Do inform your doctor about all the dietary or vitamin supplements. A quick tip, you may wear something short-sleeved on the test day. Now let us talk about the results. Abnormal results may mean that you have a blood vessel disorder. It can be a genetic platelet defect such as hemophilia or thrombocytopenia. However, your doctor might require additional tests to confirm the diagnosis as this test is only the screening test. Also, it is equally important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided in the description below. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.